Yeah, sure. So I think there's really a number of factors. First, there's some negative pressure we're seeing from reimbursement changes. If you look at the impacts of the One Big Beautiful Bill Act and what that's going to do from a Medicaid standpoint, that really will heavily impact health systems, which then kind of rolls down across provider classes. And so that's a negative pressure we're seeing. And kind of in response to that, there's, in addition to some regulation around site neutrality, and pushing care into lower cost of care settings, that's really driving where we're seeing healthcare deal activity. So a lot more focus in specialties and in areas where we can, kind of bend the cost curve. So ASCs, for example, a lot of activity there, a lot of interest in that space, both on the health system side as they look to really skate to where the puck's going in terms of shifts of the site of care. And then also on the provider side, looking at specialties that could do more cases in ASCs. So cardiology, for example, orthopedics, both areas where we're seeing a lot of growth. And so that's really a driving factor. Another one I would just say would be positive demographic tailwinds, aging baby boomer population. That's really driving increased deal activity in the area of anything care at home. So home health, hospice, other kind of variations of care at home models and anything kind of adjacent to that space. So I would say those are a couple of the factors that we're seeing really drive M&A. The other thing in addition would be fragmentation in the market, still a ton of fragmentation around the physician practice management space in terms of different specialties being highly fragmented. And so while that space has been slow over the last couple years, we're starting to see some renewed interest back in some of those same areas, talking about like ophthalmology, cardiology, where there's opportunity to bend the cost curve and still a ton of fragmentation. Yeah, I think investor sentiment is kind of remains somewhat cautious, but super optimistic in terms of the long-term durability of investments in this space. If you think about the fact that almost $1 out of every $5 that we spend in the U.S. economy goes to healthcare, and it's a service that's incredibly essential to our society. Where are people wanting to private equity? Where are they wanting to invest money? Healthcare remains a top class of investment. There's still a fair amount of dry powder out there that needs a home. And so I think investors generally are still very optimistic about opportunities to invest in the healthcare space. Yeah, in the last 12 to 18 months, there have been a number of changes just in the way the deal activity has progressed. For one, investors right now are much more disciplined and conducting more robust diligence processes around revenue, durability, kind of overall quality of the assets they're looking at. I think some of this has been impacted by the fact that we've got rising interest rates and lenders that are also more stringent around their diligence processes and funds and platforms they want to lend based upon. And so we've seen, I would say, like last year, a bit of a slowing in some of the just add-on activity and a focus towards more of the mature platforms that have a long-term track record of quality and durability in their services and revenue.